example of a feedback mechanism where I said that if the blood glucose was low, there are receptors in the body which sense that, and it goes to the pancreas. The pancreas stimulates the alpha cells in them to liberate a hormone known as glucagon. Glucagon causes release of, it causes breakdown of something called glycogen in the liver and skeletal muscle and releases glucose into the bloodstream, so your blood glucose level rises. And now when your blood glucose level has risen and come to the optimal level, the stimulus is no longer there. And so no longer are the alpha cells of the pancreas stimulated, so no longer is glucagon being produced, and so blood glucose level doesn't continue to rise. Okay, so this is what I said. Now, there are some terms that you have and you understand. So we use these terms, and don't get sort of stuck on trying to identify which one is which, but I just want you to realize how these terms are used. First is the stimulus. So in this case, when we use the stimulus was this blood glucose, a fall in level of blood glucose, right? And what happened is that because of that fall in blood glucose, a kind of pathway was established towards the pancreas. So we use the pancreas as, let's call the pancreas the control center. So we call the pancreas the control center. And this was the stimulus. Okay? So this stimulus traveled to the pancreas. So as it's traveling towards the pancreas, this is known as the afferent pathway. Afferent means going towards something. Efferent means going away from something. And what happens is that in the pancreas, there are certain cells which act like receptors, which sense that the blood glucose level is low. After that sensing, what it does is the pancreas now gets to know of it, and the pancreas goes and stimulates the alpha cells. So the alpha cells are what are known as effectors. And they were receptors in the pancreas, and the pancreas by itself was also called the control center. So these alpha cells are the effectors, meaning the cell which is going to bring about the result, okay? So the effectors, what do? They produce glucagon. This glucagon now causes, it goes to the skeletal muscle and liver, causing glycogen to be broken down. So this pathway from glucagon to skeletal muscle and liver is known as the efferent pathway, meaning away from the pancreas. And what happens? It causes blood glucose levels to rise. When they rise beyond an optimal level, the stimulus is shut off. You can see it's a negative feedback, right? The result prevents the stimulus from continuing to go around in the same loop. And negative feedback mechanisms work all the time in our body, especially with the endocrine system, because we always want hormones to be produced in minuscule amounts so that they can do their job and, keep everything at an optimal level. But also in the body, we have a mechanism where you have something known as a positive feedback mechanism, where the stimulus goes through the same pathway, but the result causes the stimulus to continue to stimulate. So it's kind of an ongoing loop. It just goes on and on. Positive feedback mechanisms do not occur in our body all the time. They occur only at certain times. This is one example, like nursing a baby. It's not all the time. It's only after a woman is pregnant and she has delivered and she nurses the baby. The same goes for uterine contractions. And I'll give you the same example. Again, it's not that every day you have these uterine contractions. It's only when she's pregnant and she has to go into labor, the uterus contracts and pushes the baby out. Another example is clotting of blood. Okay, so again, it's not something that happens all the time. So positive feedback mechanisms, unlike negative feedback mechanisms, do not occur all the time. They occur only in certain times during our, during our life. So let's look at this example. So let's say a woman nurses a baby. That stimulates, just by nursing the receptors on her breast, they cause an afferent pathway to go all the way to a gland called the pituitary gland. And from the pituitary gland, they have two hormones which are produced called oxytocin and prolactin. One causes ejection of breast milk and one increases the production of breast milk. So milk production is increased, it's also pushed out of the breast. The more the milk is produced, the more it is ejected, the baby nurses more. The more it nurses, the more prolactin and oxytocin are produced, and the more the milk is, that cycle goes on and on, okay? So can you see it occurs only in certain periods. Another example is uterine contractions during labor. So when the baby's head begins to descend, it stretches the cervix. That goes and stimulates receptors, and it goes all the way up again to the pituitary gland where it stimulates oxytocin. Oxytocin gets liberated, comes down and causes the uterus to contract more. The more the contractions, the more the oxytocin is produced, and that's how the baby is able to pass out of the birth canal. Okay, so can you see it's an ongoing process, it goes on, and then once the job is done, like the baby is born or a woman stops nursing, the process ends. Same with blood clotting. One clotting factor is produced, it causes another one, it stimulates the production of another one, which stimulates the production of another one, so it's like a domino effect, so it goes on and on and on till clotting sort of occurs, and when there's no more need for clotting to occur, it stops. So can you see these positive feedback mechanisms are not everyday mechanisms, happen once in a while and only when the body needs it. Okay? Yes.
Since we're always trying to maintain homeostasis, that's why that happens all the time.
What's that?
The negative feedback.
Yes, the negative feedback tries to maintain exactly. It tries to maintain homeostasis, so that's why it has to switch off something, because if it allowed it to continue, then you would get imbalance, right? The hormones would be produced or in excess, and giving you the example of glucagon, your blood sugar levels would keep on rising, and you would have more than that you need, isn't it? So that becomes a problem. So that maintains homeostasis.
But isn't that what diabetes is?
Diabetes is a different condition where it could either be insulin production is very low, or insulin production is enough that the body is sensitive to it. Insulin acts exactly opposite to that of glucagon. So what happens is it pushes the blood sugar into the cells, so that's why it's needed. So if insulin is not produced, your blood sugar levels rise, and it'll continue to rise because it's not being pushed inside the cell.
Okay.
So that's a homeostatic imbalance that is occurring there. Okay. Now talking of imbalance, what happens is sometimes, like here, in insulin production is low or something, there's homeostatic imbalance, your blood sugar keeps rising, right? There's no switch to turn off the production or increase the production of insulin because that's not working. Sometimes these negative feedback mechanisms don't work, or they're overwhelmed, and positive feedback mechanisms come about, and that causes a homeostatic imbalance. One example is, like I gave you an example of this glucagon and insulin is opposite. If say you ate or you just came, you had dinner and you come to class, so your blood sugar levels have gone up. So what happens is the pancreas, the receptors in the pancreas sense that blood sugar levels have gone up, so they release insulin. What insulin does is it takes that blood sugar, pushes it into the cell, blood sugar levels come down, and insulin is switched off. Okay? Now, in someone with diabetes, they are not producing insulin. So the blood sugar level keeps on rising because it is never able to get inside the cell. So that's turned off. So that's homeostatic imbalance, right? So you keep eating, your blood sugar levels keep going up. Similarly, you might have pituitary tumors or tumors in the thyroid gland where hormone is produced and it should go up to an ideal level, and then there should be a negative feedback mechanism to turn off the production of hormone. But when you have these tumors, the production keeps on going because a negative feedback mechanism has gone off. So it's actually like a positive feedback. It just goes on and on like a circle, and you end up with things you may have heard of, people who grow to gigantic proportions. That condition is known as gigantism. You may have heard of something called acromegaly. So these are all situations where that negative feedback mechanism is overwhelmed or it's not working due to some reason, and something like a positive feedback mechanism occurs and you have a homeostatic imbalance. Okay? So let's answer this question. Which of the following is an example of a negative feedback mechanism? Low blood calcium? You have to answer using, I don't have. Share, if you don't have clickers, just share with the person next to you. Well, I'll read it out if you can't read from there. The first one you can see during labor, as uterine contractions begin, levels of the hormone oxytocin continuously rise to further stimulate more contractions. Second is a person suffering from an autoimmune thyroid condition will often have high thyroid hormone levels and an enlarged gland due to continuous thyroid gland stimulation. And the last one is low blood calcium levels cause secretion of parathormone. Parathormone levels decrease when blood calcium reaches normal levels. Okay, C is the correct answer because look at this, low blood calcium causes secretion of parathormone. So that brings the blood calcium back to normal and parathormone levels decrease. So can you see there's a negative loop over there. This first one is during labor, which I just explained, was a positive feedback. You're continuously stimulating oxytocin production, so labor continues, further contractions. The second one, as I said, in endocrine, you want the levels, once the level has reached optimum, you want it to go down. You don't want the hormone to keep on being produced, otherwise you'll have a hyper condition. So that's an imbalance too. Yes. So here, a person suffers from an autoimmune thyroid condition where they have high thyroid hormone levels. Normally, your thyroid hormone levels should be optimal. It should not be high, it should not be low. Because if it's low, it will cause some loop to form so that you can stimulate the gland. If it's high, then the gland should not be stimulated, right? So here you can see you have high thyroid hormone levels and an enlarged gland due to continuous gland secretion. That means the gland is going on being stimulated, it's going on producing thyroid hormones. So can you see a loop that's going on and on and on, okay? So that's an example of homeostatic imbalance. So the last one is the correct answer. So now we're going to learn the language of anatomy, and everything that we use, we have to be anatomically correct. Yes?
Real quick, this one, like, graphing of negative, I associate with the bad way. So this wouldn't necessarily...
No, it's not bad. Yes, no. We need the...
It's like a water faucet that if you turn on, you need to turn it off. So that is exactly what we are doing.
You've got to turn it off, okay? So it's not bad. Yes, I know when you use the word negative, you tend to... No, you need it to happen. Yeah. Okay, so we're going to learn some terms, and one of the terms I mentioned right in the beginning, and make sure, because you do have questions in your quiz. Remember, there's a quiz which is assigned today and due on Friday. You will have questions in that quiz which have to do with surface anatomy. Remember, I told you all I want you all to look at that slide of surface anatomy, all the various, how you kind of name the parts like brachium and tibial and radial and, sural area, femoral and all that. So make sure you look at that because you do have questions on that, okay? So that's something that you've got to do because I would just be reading out. So here now I'm going to use some more terms. And whenever we use terms in anatomy, everything is always taken in the anatomical position, which is the position shown in this image, which is as if a person is standing erect with their arms by the side, palm facing forwards, and your eyes are looking forward. Everything in the body is taken in this anatomical position. You might take a structure out and hold it, this way and that way, and that's a different thing. But when we kind of section thing, like which I'll tell you, like say you take a kidney out and you section it, you have to assume that it is in the anatomical position and then you made these sections, and that's how you will describe the sections, okay? So everything is taken in the anatomical position, which is this. And while using this, we have two terms which can be used for limbs, which can be used for skeleton, which can be used for muscles, and these are axial and appendicular. Axial means lying in the central axis of the body. So all of this is the central axis of the body, which means the head, neck, the thorax, the abdomen and the pelvis. So all this area is part of the axial. Is the axial portion. So I will say axial skeleton, I will mean all the bones which lie in that. Axial musculature, all the muscles which lie in that part. Okay? Appendicular is to do with the limbs, the upper and the lower limbs. And the reason you use the word appendicular is because when the body develops, these appear as appendages, as tiny little flippers, appendages. So that's why we use the word appendicular, which is the limbs, the upper and the lower limbs. That's the appendicular. So appendicular skeleton, appendicular musculature, I mean muscles or bones of the upper and lower limb. The first thing is section. So whenever nowadays we use you all have at some point had or have heard of somebody having an MRI or a CT scan or an X-ray. So the body is kind of sectioned in different planes. So we use three major planes, and these are known. The first one is called a median sagittal plane, and the section is known as a median sagittal section, or it may also be known just as a median section or median plane. The plane is the plane in which your section is. So a median plane is one, or a median sagittal, they are the same, is one where you go right through the center of the body and you divide it into an equal right and a left part. Okay, so if I took a saw and went right through the middle of my body, right and equal right and left parts. The reason it's called sagittal is because there is a suture present in the skull. A suture is a joint. The suture is present in this part of the skull. It's known as the sagittal suture. Any section, you can have other sections, you don't only have to cut right in the middle. You can have sections which are parallel to this median or median sagittal, which can go like this. These would be known as parasagittal, or also simply known as sagittal sections. So here also you will divide it into a right and left portions, only they will not be equal right and left portions. Why para? The word para in anatomy means by the side of. Many anatomical terms have a Latin basis to them. So the word para means by the side of. So you can see by the side of the sagittal suture. So that's why parasagittal. Okay? So again, you divide it into left and right, but they are not equal in a parasagittal or a simple sagittal section.
Is there a difference between a simple sagittal and
no, parasagittal and sagittal are the same. They're synonymous. The next one is transverse and horizontal. For most parts of the body which are lying vertically, transverse and horizontal are the same. So your trunk, for example, is vertical. This is your long axis or the length of your body. Your limbs, like this is the long axis or the length, okay? So for most parts of the body, transverse and horizontal, where the structure is vertically placed, it means the same. But let's define them. The word transverse, first let me do horizontal actually. Horizontal is a section which goes from front to back. So if I take a saw and I just cut my body from front to back, so that I divide it into an upper and a lower part. So a horizontal will divide it into an upper and a lower part. So you can see here upper and a lower part, upper and lower, upper and lower. Can you see that? Okay. And that section always, the plane always goes through the front and comes out through the back, this way. By definition, a transverse section is a section where the plane is taken in perpendicular to the long axis of the structure. So before you write, understand what I'm trying to say. In a transverse plane, what is a transverse plane? A transverse plane is any plane that is perpendicular to the long axis of the structure. Long axis means the length of the structure. So if I look at my body, this is the length of my body. So this is the long axis, perpendicular to it is this way. So can you see this? In this case, the horizontal and transverse is the same. So again, when anything is long like this, I cut this way. This is the perpendicular to the long axis. So here, horizontal and transverse are the same. Understood? Okay? But by definition, they are different because in certain parts of the body, they are not the same. So that's why you have to know the definition.
In which body parts are they?
I will tell you. So as you can see, so for all practical purposes, what you should know is anything which in the anatomical position is vertically placed in the body, transverse and horizontal mean the same. Okay? And you can see in both cases, you will have an upper portion and a lower portion. Transverse sections which are sections which are cut in the transverse plane, often you might have heard of them as cross sections. So can you see over here? This is like if you were to look just as a little bit like this. This is a cross section taken through the trunk. Okay. Next is a coronal plane. Coronal again is named because of a suture that goes from one ear to the other, present here, called the coronal suture. But unlike the sagittal, you don't have anything like a mid-coronal and then a paracoronal or anything. All sutures which are, all sections which are cut in planes which go in such a way that you divide that structure into a front part and a back part are known as coronal sections, and that plane is a coronal plane. So a coronal plane goes through the body in such a way that it divides it into a front portion and a back portion, like you can see here. So this is one example. This is also a coronal plane. This is also a coronal plane, and the sections that you will see will be coronal sections. Follow? So if I was to take my body like this and I remove the front, what would you see? You would see the inside. You would see the posterior abdominal wall. Right? Here is an example of how a transverse and a horizontal are not always the same. So we already talked of median, sagittal, coronal and frontal. So let's look at this picture. This is the picture of the pancreas, which lies transversely across the body. So it's not like vertically like this, it goes across the body this way. Okay? Now here, by definition, what is a horizontal section? Anything that, a horizontal plane, anything that goes from front to back and is dividing it into an upper and a lower portion. So can you see if I was to cut it in a horizontal plane, this is how I would cut it. So I have an upper portion and a lower portion, right? A transverse section, on the other hand, by definition is a section cut in a plane which is perpendicular to the long axis. So what is the long axis or the length of the pancreas? This way, right? So when I cut it this way. So now I'm actually dividing it into a right and a left portion. So here, this and the sagittal are the same, isn't it? Can you understand? Because what does sagittal do? Divides it into a right and a left portion. Have you followed? So can you see that it's not always the same? I'll give you another example. Or you tell me, can you think of any other structure? And I'll give you a hint. It's a bone which lies not vertically like this, but horizontally across the body.
Rib cage?
Ribs, yes, the ribs, very good. See, the ribs are lying like this. So again, the transverse and horizontal would not be the same. Anything else? Somebody said?
Pelvis.
The pelvis is, it's a huge thing. It lies pretty much in a vertical, and it's an odd-shaped one. I heard something else. Collarbone, very good. Yes, clavicle, this way, right? So if you look at the clavicle,
my baby.
you look at the clavicle like this, and I take a transverse section, what I'm going to get is one end of the clavicle this way. And if I take a horizontal section cutting it this way, I will find an upper part and I'll find a lower part, right? So anything that lies horizontally across the body, horizontal and transverse do not mean the same.
Which one was which? I'm sorry.
So going this way is a transverse, perpendicular, and going this way is horizontal. So here this is horizontal, this is transverse.
So transverse you can only use for the parts of the bodies that you just mentioned?
No, you can use it, when you cut a section like this, normally in medical terminology, we usually tend to use transverse instead of using the word horizontal.
Oh, okay.
So you can say this is a transverse or cross section of the trunk, or this is a cross section of the arm, or you can say it's a horizontal section. So you can use them interchangeably there, but you cannot use them interchangeably for these parts which lie across.
Okay, so like the ones we said.
Yes.
Okay.
So here, take a look at this picture. So you can see this picture, and if you don't understand what it is, it's a picture of a side of the body. This is the vertebrae at the back, the vertebral column, and this is the vertebral canal. And up here is the pubic bone. This is the liver, the part of the stomach, the intestines, the bladder, uterus, and rectum. So choose which section do you think this is. Yes, very good. Most of you got it right. It is a sagittal section. Remember, a sagittal section is, I've cut through like this, right? So this is the part, I'm seeing one half. I just turned it around and I'm showing it to you like that. When you take a sagittal section, you will only see, if there are organs which are present on both sides, you will only see one side organ. Or if there is one organ which is cut right in the middle, like the stomach or the liver, can you see how it's been cut through? It's been sectioned through. So this is a sagittal section, okay? I'll show you coronal section. I will show you. Yeah. I'll be showing you these sections, so don't worry. Let's look at some other terms. And I use the word, remember, median sagittal. Median means, remember, right here in the midline, that was it. So the word median means right in the midline. Okay? Anything close to the median line is known as medial. Anything further away from it is known as lateral. And then you have the word intermediate also, which means any structure which is in between something which is medial and something which is lateral. Now you understand these are very relative terms. You cannot always say one structure is always medial. And let me give you an example. The nose, I would say for all practical purposes, is a median structure. Right? We all hope it's right in the center of your face. And let's say the eyes are lateral to the nose, but the eyes are medial to the ears, right? Yes. The ears are lateral to the eyes, but they are medial to the shoulder, okay? And if I was to take the eyes, the ears, and the shoulder, I would say the eyes are medial, the shoulder is lateral, and my ears are intermediate, right? So again, it's very relative depending on which structures you're comparing. So the closer it is to the midline, you will say it is medial. The further away it is from the midline, you will say it's lateral. And if you're taking two, one medial, one lateral, something in between would be called intermediate. Okay. Now in the upper and lower limbs, instead of using medial and lateral, we often use the use of a bone. In your forearm, the ulna is a bone which is present on the medial side of your forearm, and the radius is a bone which is present on the lateral side of your forearm. In the leg, the tibia is the bone on the medial leg, and the fibula is a bone on the lateral side of the leg. Okay, so in your forearm, instead of using the word medial, or in your leg, instead of using the word medial, you may use the word ulnar and tibial. For example, I could say that the tibialis anterior muscle lies on the tibial side of the leg, and the peroneus tertius lies on the fibular side of the leg. Or I could say the tibialis anterior is medially placed in the leg, and the peroneus tertius is laterally placed in the leg. Do you understand? We are just switching the terms based on the bones. Follow? Yes? No, you're a little confused.
In relation to what? What's the median to that name?
No, here when we say medial and lateral, here in the forearm, this is the ulna which is present on the medial side of your forearm. This is in the, remember everything in the anatomical position. So this is closer to the midline, and this, yes, it always has to be the midline, right? Okay, so that's why. So it all remember in the anatomical position. So if I have a muscle which is present here, I would say this muscle is ulnar in position compared to this muscle which is radial in position. Got that? Instead of saying this muscle is medial and this muscle is lateral, I might also use the words ulnar and radial, or tibial and fibular. Yes.
So ulnar is closer to the
Yes, ulnar is closer to the midline. That's why it's medial.
Do you have to use them like ulnar, radial, and then tibial and fibular? Or can you like switch them like radial and tibial? Or do you have to use them? You know what I'm saying?
No, why I did it that way is just to tell you that ulnar and tibial are both synonymous with the word medial.
Right, so it doesn't matter which, if you use like the opposites.
No, it does matter because you can't say a muscle here. You cannot, in the muscle in the forearm, you can't say a muscle, so, let's say, oh boy. You can't say flexor carpi radialis is fibular in position because it's lying in the forearm. So you have to use it with the bones of the forearm, which are ulnar or radial. Got that? So if there's a muscle in the leg, then you can't use ulnar or radial. You would have to use the word tibial and fibular. Have you followed? So in other words, the terms ulnar and radial or tibial and fibular, which you use in place of medial and lateral, can only be used in the region where they lie. So because ulnar and radius lie in the forearm, you can use the words ulnar and radial only for forearm terms, and tibial and fibular only for leg terms or the lower leg. Okay?
Okay, just so I have this straight, ulnar and radial mean the same, depending on whether you're talking about in the arm, it's the...
No, ulnar and radial don't mean the same. Ulnar is medial, radial is lateral. Look there.
But it's all in the arm.
It is all in the forearm.
Okay,
Tibial and fibular are in the leg. Yes.
okay, that I got.
Yes. Then we have two terms called posterior and anterior. Posterior also, most part is synonymous with the word dorsal. Anterior is synonymous with the word ventral. Especially for the trunk region, I'll tell you where there is an exception. But let's look at what these terms mean. Anterior means towards the front of the body. Posterior means towards the back of the body. Which means ventral would mean towards the front of the body, dorsal would mean towards the back of the body. Which is why, if you look, if somebody was to tell you scratch the dorsum of your hand, what would you scratch? It's this back of your hand, right? Dorsum, back. So, and in the anatomical position, this is front, which is palmar, and this is dorsum. Can you see that? In the foot, it becomes dorsum and plantar because the foot has changed. Now, here to show you this image here. So this is, what kind of section do you think this is?
Transverse.
Very good. This is transverse section or a horizontal section, right? Cut through like this. And here, if you look, this is the vertebra. This is the sternum. So this, the vertebra is towards the back. So this structure here is posterior or dorsal. This structure is ventral or anterior. And then this one here, the aorta is in between the two. So we can call that intermediate. So again, it can be relative. So if I have 5 different structures here, then we can say that this one is posterior to this, but it is anterior to this. So again, these are very relative terms. Now, why did I say posterior and dorsal and anterior and ventral was synonymous for most of the body, not all? This is very similar to where we have that transverse and horizontal. And the reason for this is that when the fetus was developing, it has a little head like that. There's the pericardial cavity. Here is the umbilical cord, and here is something called the tail fold. And this is where the eyes will develop, and then the ears and so on. This is the area where the limb buds appear. The upper limb bud and the lower limb bud, the appendages, which is why we call it appendicular skeleton. So what I'm showing you is on one side. So here's the upper limb bud and then the bud on the other side and the lower limb on the other side. So when the upper limb bud develops, what happens is in anything facing in front was anterior, anything facing behind was posterior, right, by our definition. Ventral and dorsal are embryological terms. So ventral also means, in embryology, when it is ventral, it happens to be facing in front and dorsal is facing at the back. So now the upper limb bud develops like this and comes by the side this way. So now your anterior is still facing in front, posterior is still facing back. This, remember, was ventral, it still faces in front, and this dorsal faces back. So you can see how ventral, dorsal, anterior, posterior are synonymous. The lower limb buds, so they are like this, the lower limb, and so this was anterior and posterior, but this was also the ventral surface and this was the dorsal surface. So what happens with the lower limb buds is as they are developing, somewhere around the mid-thigh region, the lower limb actually undergoes a twist. So it becomes like this. Okay? So instead of coming straight down like this as it's drawing, it's undergoing a twist like this. So can you see now the ventral surface is actually facing the back and the dorsal surface is facing in front. So here anterior and posterior and ventral and dorsal are not the same. And this is the reason why in the upper limb, the bend of your elbow, this cubital fossa, this little tip, is on the anterior surface, but can you see up here, the fold of your knee is on the posterior surface, which is like this. So therefore, from the knee downwards, anterior still, the word anterior always means closer to the front and the word posterior always means closer towards the back. But ventral and dorsal, like I said, were embryological terms. For most of the body, it is the same as anterior and posterior, except from the knee downwards, where ventral becomes the same as posterior and dorsal becomes same as anterior. Okay. When it becomes important is when we start doing muscles and actions. So then you should know when we talk about bringing ventral surfaces together, and that's why I want to explain it right now here itself. Okay. Then some more terms that we have. We use the word superior or cranial or even cephalic when anything is closer towards the head end of the body, upper end of the body. Cephalic means the head, cranial also for the cranial cavity and the cranial bone. So superior is when anything is closer to the head end of the body or the upper end of the body. Inferior is when it is closer to the lower end of the body. This is used for the trunk, for the axial part of the body. So when you're talking about your lips, your nose, your umbilical cord, your pubis, all this you would use the word superior and inferior. For example, your lips are inferior to your nose, but they are superior to your chin. Right? Okay? So again, it becomes very relative. In the nervous system, we use the word rostral, which again is closer towards the nose part, but we won't be using that term very often. For the appendicular skeleton and even muscles, so this is for the appendicular part of the body or the limbs. Instead of using the words superior and inferior, we use the words proximal and distal. So proximal is similar to superior, distal is similar to inferior, but you cannot use the word superior and inferior when you're talking about the limbs. You have to use the word proximal and distal to be anatomically correct. So which do we take? There's no head end in the limbs, right? So here we take the point, the landmark, as the attached end of the limb. So for the upper limb, the attached end is at the shoulder. So when anything is closer to the shoulder, we'll say it is proximal. When anything is further away from the shoulder, we'll say it's distal. So proximal and distal refer to being close to the attached end, close or further away. And in the lower limb, it is the hip, where the lower limb is attached at the hip. So the closer it is to the hip joint, we'll say it's proximal. The further away, it will be distal. As I said, it is similar to superior and inferior, but you cannot use those terms, okay? You cannot say the elbow is inferior to the shoulder. What you will say is the elbow is distal to the shoulder, or the elbow is proximal to the wrist. The knee is proximal to the ankle. The ankle is distal to the knee. Follow? This is just something that you have to learn, and it will come quite easily. However, to make it a little bit confusing for you, sometimes you will find that you're reading books, or you're looking at bones in the lab, and it'll say the upper end of the tibia or the upper end of the humerus, or it might say the superior end of the humerus and the inferior end of the humerus, and then you wonder, this is part of the limbs, but how are we using the term superior and inferior? Because it belongs to the limbs. So for bones and for joints, there's a little bit of anatomical license that we have. We are allowed to use it because when we study these bones, we take them out of the body and we are studying them. Okay? So it is not incorrect when we are looking at bones. It's better that you use the term proximal and distal, but if you find someone using the term, the proximal radio-ulnar joint or the distal radio-ulnar joint, you wonder, superior radio-ulnar joint and inferior radio-ulnar joint, you're saying, how come they're saying that? This is the limbs. I mean, they should be using the word proximal and distal. The reason is because the skeleton is often studied outside the body, so this is kind of something that has come along the times, and it's going to take a while for it to, go away. So that's not wrong. They're not wrong when they say that. But otherwise, for all practical purposes, when you're talking about the limbs, you have to use the word proximal and distal. Then we have the terms palmar and plantar and dorsum. So palmar was the palm of your hand, which is this anterior. Dorsum is the posterior aspect. Plantar is the sole of your foot. And since the foot, instead of lying like the palm, it's kind of down this way, the top of your foot is called the dorsal aspect, or the dorsum of the foot, and the bottom is the sole is known as the plantar aspect. Okay. We also have superficial and deep. Superficial is used when any structure is close to skin. Deep is when it is further away from skin. So to give you an example, muscles are superficial compared to bones in most of the body. Okay? Muscles are superficial compared to bones because muscles are closer to the skin than bones are. When you take organs, instead of using, because there's no, they are all deep inside. So we don't use the word superficial and deep. Instead we use the word external and internal. So the outer surface of an organ is known as external, and the inside or the cavity of an organ is known as internal surface. So I would say you find many blood vessels on the external surface of the stomach, and when you open up the stomach on the internal aspect of the stomach, there are a lot of mucus folds. Okay, so just tells you the inside, the cavity is internal, the outside of an organ is external.
Outside of an organ.
External, and the cavity, the inside of an organ is called internal. So here is just giving you examples of proximal. So this is proximal, this part is distal. You can see this here is showing you the tendon of a muscle. This is superficial. Some people like to use external, but like I said, it's better to limit external and internal to organs. And then here, these are deeper structures. After this muscle has been cut, you can see blood vessels and nerves. So the muscle is superficial compared to these blood vessels and nerves. Okay. Then when we open up the body, we look inside, we see there are cavities present inside the body. So there are two cavities, and then one is further divided, and they're further divided into subdivisions. So one body cavity lies posteriorly, and one body cavity lies anteriorly. So this one is known as the dorsal body cavity, because remember in the trunk region, dorsal and posterior and ventral and anterior are the same. So this yellow one is the dorsal body cavity, and this here is the ventral body cavity. So you can see closer to the front, dorsal body cavity is further divided into a cranial cavity which houses the brain, and a vertebral cavity or a spinal cavity which has the spinal cord. So the vertebral canal or the spinal canal which has the spinal cord. It's well protected because these are very sensitive and important organs, so you need to protect them. So that's why you have the skull and the vertebral column. The ventral body cavity is divided into an upper part called the thoracic body cavity and a lower part called the abdominopelvic, and the structure which divides them is a muscle which is known as the diaphragm. So here you can see the diaphragm. The abdominopelvic cavities, there is no muscle which kind of divides, unlike the thoracic and abdominopelvic, there's no muscle which divides the abdomen from the pelvis. It kind of gently blends from the abdomen, it goes into the pelvis. When it passes through the pelvic rim, there's a kind of rim of the pelvic in the pelvic bone, so when it passes through that, you go into the pelvis. Above that is the abdomen, okay? You have certain other cavities which are not truly body cavities. For example, synovial, you often refer to the oral cavity, the nasal cavity, the orbital cavity, but we don't include them in these main body cavities, okay? Middle ear cavity, we kind of often describe when we talk of them, but they are kind of other subsidiary cavities not included in these two main divisions, the dorsal and ventral. Yes, I'm coming to that. Good, you're reading. There's another term called mediastinum, which you might find. Mediastinum is a part in the thoracic cavity, which is the area in the center, and it is the area present between the two lungs. So if you look here, this is the thoracic cavity, here are the lungs on either side, and the area in between the lungs, going from the front to the back, from the sternum all the way to the vertebral column, there's an area in between. That is known as mediastinum, and this houses important structures, of which one of the most important structures is the heart. Now, here we have your serous cavities. So inside the ventral body cavities, you have thin bags of fluid, like little balloons. These are known as serous cavities. So they are in the thoracic cavity and in the abdominopelvic cavity. And what they are is, so don't write, just listen to me and imagine you have a box, okay, or just any cardboard box, and let me say I call this the thoracic cavity, okay. I have a cardboard box and then I put a green bag inside. So this is your thoracic cavity, and this green bag that I put is your serous cavity. So you can see it's one layer, right? It's going all around like that. Now suppose you were to sit on this. So here's your tushy sitting on this. And what will happen to the green bag? There will be a part which will be in close contact with your bottom, and there will be another part now which is going to be squished along the sides. Can you see, which will line the inside of the box? Okay. So therefore, this part which is in close contact with your bottom we'll call the visceral layer, and this part which lines this body cavity we'll call the parietal layer. And what is present inside is, this is the actual cavity now, and it has little fluid inside, because I said it was a thin fluid-filled balloon inside, okay? So it has a little bit of fluid which prevents friction. So now let's look at, put this together. So here in the serous cavities that we have are the pleural, pericardial, and the peritoneal. The pleural and pericardial are present in the thoracic body cavity, and the peritoneal is present in the abdominopelvic body cavity. So So this image is showing you this serous cavity and how a water-filled, imagine a water-filled balloon is being indented by a growing organ during development. So here there are no layers, there is just one single layer like this. So imagine any organ, let's take the lung. It is invaginating, it is pushing into this balloon. So this thing we call the pleural cavity. When it pushes in, one layer is in close, intimate contact. You cannot actually separate. In this picture, it looks like there's a gap. It just lies very closely adherent to the outer surface of the organ. We call that visceral layer. The reason we call it visceral is because organs are also called viscous. Another word for an organ is viscous. So it's called the visceral layer, in other words, lining the organ. And then this other layer, which will be the one which will line the walls of the thoracic cavity, we call the parietal layer. Parietal means the body wall. Okay, so this layer will be the parietal, this will be visceral. So in the thoracic region, you have one pleural cavity on either side, one for the right lung, one for the left lung, and then one pericardial cavity right in the middle for the heart. Okay, which if you look at this picture here, so there will be a pleural cavity here on either side and one for the heart. Okay. In the abdomen, you have the peritoneal cavity, which instead of being invaginated by just one organ, you have many organs which kind of push into it. Okay, so you'll have it going into all kinds of folds. But what you can understand is that the organ is only surrounded by this. If this was the lung, it is only surrounded by the pleural cavity. Or this was the heart, it is only surrounded by the pericardial cavity. It does not lie in the pericardial cavity, right? Have you followed that? You do not sit inside the beanbag, right? You're sitting on the beanbag. Your whole tissue is only surrounded by the beanbag, but you're sitting in that brown paper box. Followed? Okay?
Question.
Yes.
So this whole lining of the organ,
Yes.
part, that's supposed to be.
It is supposed to be intimately attached to it. So ideally, it should be like this. I just wanted it should be this way.
So should that little arrow go up to that?
Yes. Well, that's because I showed this line. If I really should have drawn this whole thing right up to the top.
Okay.
Yes.
But it's the lining of the
Yes.
organ and not the cavity.
Not the yes.
Yeah.
It lines the organ. So here you can see the serous cavity. So here is the fluid. If you look at it over here, so here we go all the way around. This is where it is lining the inside of the thoracic wall. Then it goes on the diaphragm. So this is the parietal layer. Then it comes and then becomes the visceral layer which lines the organ. So one pleural cavity on this side, all this little blue line, filled space is the pleural cavity. You can see how thin it is. It just surrounds the organ so that it provides frictionless movement when the organ moves. This is the heart and here is the pericardial cavity. Again, just surrounding it. And here this is in the case of the abdominopelvic region, the peritoneal has been invaginated by so many organs that the whole peritoneal cavity you can see is just surrounding these organs. And in certain parts it kind of forms little folds, like double layered folds, which are known as mesentery. So double layered fold of peritoneum which suspends an organ is called a mesentery.
Oh, so it suspends.
It just suspends it. It's kind of
Organ example for what?
here, intestines. It's suspending the intestines. Yeah, intestines or stomach. So it's just a double fold. So you can see here too, there's a double fold, double fold, double fold.
Right.
So mesentery is just a double fold which suspends these organs inside the peritoneal cavity. Okay? This is an example showing you the thoracic cavity. So here the pleura, the parietal pleura would be present here on the outside. As you can see here, lining the thoracic wall, it lines the diaphragm, and then it will go up here. And now, here where it's lining the lungs, this is where it will become visceral pleura. And here again, then it becomes parietal. Can you see that? So here, this part here is the pericardium. Up here is parietal pericardium. Here, intimately attached to the heart is the visceral pericardium. This is a section a coronal section. Can you see a coronal section? You can see both lungs. The front of the thorax has been removed and now you're looking at the rest of the thorax. And you see coronal like this, okay? Here again a coronal section, again a coronal section. Up here, can you see the front of the abdominal wall has been removed? Here again the front has been removed and looking at the posterior aspect. So this is just showing you the superficial dissection. So here you can see the liver, gallbladder, you can see some of these folds of peritoneum, and then when you remove all of that, you can see some structures on the posterior abdominal wall. You can see where the kidneys are lying, the spleen. I'm kind of just showing you some organs. There's nothing much that I really want you to learn from this, but just that you recognize it's a coronal section, and when there are organs which are symmetrically placed in a coronal section, you'll see both organs, right? And here it's showing you abdominopelvic. So again, this is kind of coronal, and you're looking at it from the top. This is a sagittal view, which you can see here. Only one half is being seen. The other terms we use is when we want to, especially in medicine, and a patient comes in, you want to kind of be able to indicate where exactly the patient has a problem, where exactly is he describing pain, or where exactly is he describing a lump. So you divide the abdominopelvic region either into what are called two quadrants. So the quadrants are just four like this. You go somewhere around the middle of the umbilicus and cut it. So you have upper right, upper left, lower right, lower left. Or you divide it into 9 abdominal regions, as you can see up here. And these are the 9 regions. So you take 2 lines which go from the middle of the clavicle all the way down, and 1 line which goes just below the costal cartilage, and one just above the iliac crest. So you have 9 regions. So if you begin here, this is called the hypochondriac. Chondra means cartilage, hypo means below. So since this is where the costal cartilages are, it is below that, so that's why you call it hypochondriac. So you have a right and left hypochondriac. These 2 areas are next to the lumbar vertebrae, so these are called lumbar regions. And this part here is in relation to a bone called the ilium, and there's a fossa there called iliac fossa, or it's also called the inguinal region. And here, right in the midline, the center is umbilical. Above is epigastric. It's called epigastric because the stomach lies somewhere, as you can see here. This is where the stomach is. So this part is lying above the stomach. So epi means above, gastric for stomach. This is called hypogastric because it's below the stomach. So that's how the names came about. So look at this picture up here, and you should even use your books. So I want you to use your lecture textbooks to find out what each body system, what its functions are apart from your notes, and also to use some pictures to see where many of these organs are lying. So from this picture you can kind of make out that the liver lies in the right hypochondriac and epigastric region. It really doesn't go up to the left hypochondriac. The spleen and the stomach lying here. So you can see all this. So take a good look at this picture, and let's just see whether you can answer this question. Which body region do you think the urinary bladder is located? Just by common sense, you should be able to answer this question. Where is the urinary bladder located? Hypogastric. Yes, the urinary bladder is in the hypogastric. See, this is the umbilical area up here. So your bladder is not here. Only when your bladder is full and really full, beyond 500 ml, does it kind of go up all the way up. Otherwise it's lying here in the pubic area or the hypogastric area.